Small world, small world. But thank you for being here.
Yeah,
You know,
thanks. I'm happy to be here.
Morgan gave us a couple minutes. So I was like,
Yeah.
this is my chance.
Oh yeah, please. Yeah. And I hope we can just keep it really super informal, actually. I didn't prepare anything for you. So
Sounds good. Well, if it's okay with you, I'm going to go ahead and get started on this introduction.
yeah, please.
So we have Dr. Malani with us today. So she is the University of Michigan's Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases. As Chief Health Officer, Dr. Malani serves as advisor to the President on matters of health and well-being of the university community on all 3 campuses. And you have likely seen her name on countless campus-wide emails about COVID-19. She is also the Director of University of Michigan's National Poll on Healthy Aging. Her clinical expertise includes both infectious diseases and geriatric medicine. I will just take a second to go through sort of her educational path, although I'm sure she's going to talk with you guys more about this. She's a graduate of the University of Michigan. She received her MD from Wayne State University School of Medicine. Prior to medical school, she completed a master's in journalism at Northwestern University's Medill School of Journalism. And then she completed her internal medicine residency and infectious disease fellowship at the U of M, where she also received a master's degree in clinical research design and statistical analysis. And then she did another fellowship training in geriatric medicine at the Oregon Health and Science University. She has a longstanding interest in both the clinical and policy aspects of antimicrobial resistance, infection prevention, and infections in older adults. She's published over 150 peer-reviewed articles and editorials, has edited 5 books. She continues to dabble in journalism, and her recent work has appeared in a variety of publications, including the New York Times, NPR, the Philadelphia Inquirer, and Michigan Rivals. She is also a JAMA editor, and I sent you guys out a link for this, but has had quite a few publications also herself in JAMA regarding COVID-19. So thank you, Dr. Malani, for joining us.
Yeah, thanks, Morgan. And thanks for the kind introduction. It really, it sounds like a lot of school. And it also sounds like a straight line, like there was this plan in place. And, to be honest, and hopefully this will come out in our conversation today is, a lot of what I did was just sort of follow my interests. And, to be honest, when I went to school and I started college in 1987. So, my own children are close in age to all of you. And so, this is like a full generation ago. It really, there wasn't as much sort of variation in paths to medicine. People sort of arrived, they were pre-med, they took their requirements. Biology majors were very, very popular, maybe other sciences, very few non-science majors, maybe a few engineering. So I was a little bit different back then. And I think the world has really become very open. And some of you may not even end up doing residency, for example. There's just so much that you can do after medical school, and we need people in all types of spaces. Of course, I hope most of you do choose clinical careers, because that is really a very big privilege in my life. I still do clinical work. I don't do a lot of it. But with COVID, it's certainly been really busy. And, for me, I know the focus today is really talking about editing. And, I hope we can do this like Q&A. For me, it was really an interest in writing, and one thing led to another, led to another, led to another. I knocked on a lot of doors. I think that's frankly part of being a student at Michigan for me is, I really learned resourcefulness and resilience and how to ask questions and how to get people to say yes to me. And a lot of people said no. I'll be honest, a lot of people said no. It sounds like everything just went swimmingly, but it didn't. There were times where, it certainly didn't go quite as well, but you learn from those experiences too. But, maybe I'll stop there and just see what kind of questions you have. And also just, are people across the spectrum medical wise, like M1s through M4s and in between, or is this are most of you clinical?
We're sort of all over the place, and basically M1s through M4s, and some people on research years as well.
Okay, great.
I sort of had a question for you, starting off. When looking at sort of your education and training, you talked about like sort of pursuing your interests, and it sounds like you've been able to really like bring those together really nicely. Was there ever a point where you like looked at training and you said like, oh, like to get to where I need to go, like I really need to understand this better? Or was it really just like bringing passions together?
Yeah. Again, it's so hard to even think back. So I was an M1 30 years ago, just giving you a little perspective on that. There was no internet, there were no cell phones. We read books. I studied hard. I had finished journalism school and then went to medical school. And, to be honest, I didn't do any writing at that point because it was really like school was hard for me and it was busy. I didn't have it crunched into 1 year like all of you have it, but we were busy. I think we learned a lot of things that frankly are a little bit irrelevant and are no longer taught. So the value of what you learn is probably a little bit higher, but I'm veering off here, but to get your question, I think for me, that writing, the basis of writing was so important. And I would say I'm a better editor than writer. I'm a good writer. I'm like a very solid writer, but it's not like it just comes easy. We were having this conversation in my house the other day about like people who are really good at math, and maybe some of you fit into that group, like where it's just like, wow, math just comes easy. People have like a math brain. And, I didn't have that. I had to work really hard at math. But then I thought about it. I said, maybe it's like writing for me where I liked it. I was good at it, but I worked really hard at it. And I'm still getting better. And, that's sort of the amazing thing is that like, even this long into it, I'm still getting better. I'm still learning. I'm still finding ways to use it. I might not have answered your question, but, I think having that basis in writing and editing and communication, it served me well as an M3. Back then it was different. Like you didn't read things off your phone. Like you had to know what was going on. You had little pieces of paper, maybe with, it's kind of funny to think about it. Labs and stuff were not in a computer. Like you had to write them down on paper. You had a little card with, every day you had a little block and you put, the data for that day there, frankly, it was a simpler time in terms of the electronic medical record versus, writing a handwritten note. So I think it helped me synthesize information, like being a writer. And I would think about, sort of, I think again, the journalism background where have any of you taken journalism classes? Probably a bunch of you had some interest in writing at some point, but it's like the most important thing first, then the next important, then the next important. And so, who, what, when, where, how, why. And I think for me, that's really shifted into medicine and probably for me, infectious disease, because those of you who've spent time on infectious disease or you've taken, Dr. Kaufman's class, or now Dr. Abdullah, who's taken over for Dr. Kaufman after many, many years. It really is about almost being a journalist in terms of asking patients questions.
It's interesting that you say that about like sort of the journalism structure and like good storytelling, because that's something I think is like, I guess I like recently came from the research world. So to me, that seems like probably the most like sought after, but like upfront, like perhaps undervalued skill is like telling a really good story and getting people like interested is, I think, what a lot of ultimately very successful like research article writers and like grant writers tend to do.
And the flip side of that, Morgan, is that I feel like for my research, because I'm not an official researcher, like the way that someone who's got a lab and lots of grants and, this pipetting, I certainly never have done that. I frankly, I just wasn't that good at it. It wasn't that interesting to me. It wasn't really a good fit. And I do patient-oriented health services type research. And I know some of you have taken, or your classmates have taken time off. And I don't know if it's still called MCRIT, but the MCRIT equivalent, and done MPHs, and some of you are MD PhDs. So, I think for me, I also think like a journalist when it comes to writing, that I'll see something really interesting. I'll give you one example. antibiotics at the end of life. So I'm a geriatrician and I'm an infectious disease doctor. And something that I saw happening in front of me was that patients who really were at the end of their life and probably should have been sent home with supportive care to spend their final days in comfort were instead in the hospital, and they were getting IV Vanco and IV Zosyn because maybe they have an infection when they didn't have an infection, and they spent these times here. Their families were having to sit there watching the antibiotics go in, and so antibiotics are not therapeutically neutral. They cause a lot of side effects, C. difficile, rashes, renal failure, all the complications of a line. And I got really interested in that. I'm like, what's going on with this? And I wrote a series of papers with colleagues, including my palliative care colleagues, pharmacy colleagues, like, how often is this happening? So we said, well, who's getting a palliative care consult? How many of them are antibiotics? How many of them are on antibiotics inappropriately? And anyway, one thing led to another. And that work actually got the attention of some of my colleagues nationally. And I remember speaking about it at a meeting. And again, this is where, like, that storytelling, right? Like that idea of this is not a good thing. And here's why. And the final product of all this is that I ended up on the guideline committee for stewardship. And there's a section on antibiotics at that. And so this little work that I did by just kind of watching and saying, this is kind of not good, what's happening here, but how can I write it and share it and get other people interested in it? And then to publish it was meaningful. And again, I can send you the papers. They're not like great papers. They're nothing extraordinary. They're kind of the type of research that anyone could do on a clinical rotation, just reading a chart and saying, is this appropriate or not? And basic chi-squares, little percentage proportions, nothing that required a lot of work or certainly any funding. But it was that idea of to take that observation and actually share it in a peer-reviewed publication that helped elevate the idea. And other people were working on it, but I kind of saw it because I had my eyes open. So I know it's a long way of saying this. I think when you are rounding and you're seeing patients and these questions that come up, just sort of write them down and then think about, is there something there to look at, and how can you look at it in a way that is meaningful and that can help you inform the next steps.
I don't want to
Yeah, just ask away. Zoom is not a great format. And
Yeah.
Sammy, we were talking about, life on Grosse Hill, I always thought, when there were never snow days growing up, it felt like there weren't that many snow days, but they also never plowed the streets. So I don't know how it is there today.
It's still not plowed.
Yeah.
It's going to be that way. I can just go sledding to my grandma's at this rate. I do have a kind of an off question away from editing, but more curious how you became a chief health officer and if that was planned or kind of things just started falling in place, and then the end of the day, your title was chief health officer.
Yeah. Thank you for the question. So it's really interesting is there was one other individual who was chief health officer before me. His name was Bob Winfield. He passed away in the fall of 2016. He had been here he was in his 70s. He had spent most of his career here at the health service. So he wasn't a faculty member. He was a staff doctor at the health service. He was, there when I was a student. President Mary Sue Coleman is the current interim president, acting president, or interim president. When she was president, she did a number of things. And one of the things that she did was around pandemic preparedness. And it feels like it wasn't that long ago, but H1N1, 2009. So some of you were probably in middle school when that happened, maybe even younger. And that was a point where, the idea that the campus needed somebody to really look at pandemic preparedness, and then the employee well-being services and the, student services and, interfacing with Flint and Dearborn campuses. And so Bob Winfield was that person, but he had a very, I think, different kind of role than I did because he ran the health service, and he passed away. And then the role sat for a little bit. And at the end of 2016, really after the election, and after a few things, I just felt like it was a time for me to step away from some of the stuff I was doing. So I was at that time spending a lot of time at JAMA, doing media work in addition to my editor work. And I just said, I just feel like I'm not growing, and I need to take a step away. And I feel like there's a lot of things happening that are going to happen in the health field with the new administration. And I just wanted to find something different, but I didn't know what it was going to be. And then actually my husband saw the job posting, and he's one of our faculty in ENT. And so he actually saw the job and said, "Hey, this is a great job for you." And so, I looked at it, and it was like, needs to be able to communicate, needs to, handle all this stuff. But it was a role that the former President Schlissel, was interested in finding someone who could fit in that role and grow the role. But again, it was sort of like, what are you going to do with it? So in a way, I came in with like a kind of a blank canvas, and I have had so much fun in it. It's been almost 5 years. The last couple of years haven't always been fun, but we can talk about that. I think part of why he hired me was because if there's ever like a big outbreak related to infectious disease, he felt like I would be a good person to help manage it. But what happened though, Sammy, is I really kind of made it my own. I started really like grabbing the academic piece and then the staff piece. And I started thinking about things like employers as stakeholders in health, because on our campus, we're the largest employer in the state of Michigan. I don't know if you know that. Those of us who grew up here, like us, we often think about the autos as being the largest employers, and collectively they are a large employer, and nationally they're larger employers. But right now in this state, the University of Michigan is the largest employer. And we have everyone from hourly workers to people who make millions in athletics, and the top administrators, and everyone in between. And we pay health benefits on people. And I got really interested in the idea of how can employers help nudge health equity? What can they do? Because this matters. They have a stake in it. And so I got interested in that. I got interested in the student well-being piece. And really the last couple of years have just been all about COVID. But if you listen to those town halls that we used to have, I would say COVID's not the only risk to our health, like, loneliness and academics and all this stuff. So it's been really interesting. And I would say that one of my characteristics is that I love to connect. I love to talk. I love to meet new people. And it's been an opportunity to do all those things. So it was a job I applied for. I didn't exactly know what it was going to look like, but it just seemed kind of like a great fit for me. And it's been so interesting, especially the last couple of years, because this stuff isn't going to go away, in a sense that the public health infrastructure for campus is going to need to stay. And I work really closely with a colleague named Rob Ernst. You probably see our names together on emails to you. And Rob is a graduate of Michigan Medical School, as is his wife, Susan Ernst, who's she's head of gynecology at the health service. And their son is going to start med school. He took a year off. He's starting med school at Michigan in the fall. So next fall. So many of you will get to meet him. But Rob and I have been really a good pair with this, in the sense that now there's this need to have a long-standing infrastructure, because we're going to need quarantine and isolation housing in the future, because there's still going to be sporadic cases of COVID, even with vaccination and things. So anyway, it's kind of a long story, but it's been interesting. And in some ways, I think that, it really has been an interesting experience in crisis communications. So from the journalism background, I have, and I'm a print journalist by background, and I'm an infectious disease doctor, where we sort of get everything together and we write long reports. I'm not a emergency medicine doctor or a trauma surgeon where I just like run in and act, but it's required learning some of those skills of responding quickly and being sort of thinking about where the puck is going instead of where it is right now. But it's also been a time where I think we've been able to tie the student well-being piece with the academic piece in a much more deliberate way, because people who never knew each other, didn't know each other's names, have worked together so closely. In some cases, they've never met in person, but they're on Zoom meetings all day. And I think some of you might be able to relate to that. So long answer.
I have another maybe tangential question, but
Yeah.
I'm interested in the health equity work that you're doing, and if you've felt that COVID has provided an opportunity to maybe restructure and actually develop in that area, or if it's kind of put things behind for you.
You know, that's a great question. Is it Andrew? Is that okay? Andrew. I didn't know if it was Andy or Drew or something. So Andrew, I think this is such an exciting time to be a medical student and to really be thinking about everything from social justice to health equity and really getting at these issues, because COVID has exposed all these things that were there, you know, and as I think back to 2 years ago when things were just starting to increase, and it was, you know, February, and it seemed like maybe things we were going to get away without like a big surge. And I remember saying to people, you know, we have a lot of medically frail people in this country, and we're different than a lot of the world, and we're going to see issues around equity. We've seen so much, and it's not just who will and won't get vaccinated, who will and won't end up hospitalized with COVID, but who lost their job, who didn't go to school. And, you know, if some of you have younger siblings, like what kind of like high school experience have they had? What kind of, and what are they going to look like as medical students, right? Like, what's missing? Like, how is it that 5-year-olds maybe aren't reading? You know, so all the many issues that go into health broadly. And when you've seen that pedal diagram, right? That model of health. It's a SAMHSA model. So it's not just physical health, not just emotional health, but spiritual, occupational, intellectual, academic, well, intellectual, but financial health. And so I think some of that work got pushed aside, but it's been repackaged in my mind. And right now, we have a crisis in terms of who is and isn't getting healthcare, who, you know, and the fact that the vaccination issues become so divided, and it's very predictably divided in terms of who's not vaccinated. And I think it gets at that issue of health literacy and really looking back. I mean, I'll just give you an example, an anecdote from someone I saw a couple days ago. This is a patient, a 30-something. I'm going to try to keep the details a little bit muffled because I know this is recorded, but this is someone in his 30s who you know, lives in a kind of outlying area of Michigan, and you know, basically presented with heart failure. And they called me because they were worried about endocarditis. And it turned out there were some really interesting exposures in terms of animal exposures and the type of work this individual did. And you know, I asked about vaccination, and he responded like it was the answer was, oh, absolutely no. And it turned out, I said, you know, I think he might have had COVID 3-4 months ago, and that this is heart failure from viral myocarditis. And I think that's ended up what he had. And, you know, you took the history, and it turned out a family member had COVID. He didn't access any health care. And there were just so many needs for this individual. You know, it wasn't just like, hey, there's a heart issue. They were just like amazing needs, and the complexity of taking care of someone like that who isn't living in Ann Arbor, where, you know, you can get them in and out of clinic, and, you know, there's travel and stuff. So I think as you enter medicine, and you know, it doesn't have to be, you know, part of why I went to Wayne State is I was really interested in urban health. You know, that's what I thought was going to be interesting. And it remains very interesting to me, but rural health is just as complicated and needs just as much attention. You know, again, people are farther apart, but I think the pandemic has just shown how broken our system is, and the reimagining of it is going to make things like public health and technology and, you know, the many things that you're learning much more relevant. So it's a long answer, Andrew, but I think it has to be front and center. And I actually think employers have to have a stake in this, because they are paying the health insurance pieces. And, again, whether it's vaccine mandates or it's, giving people opportunities to, not pay copays on certain medications. And, we're talking about insulin costs a lot right now. So I think it's going to be very interesting next few months.
We have a question from Sammy. Sammy, do you want to go ahead and read it?
Sure. I'm going to just kind of read what I've said because it took me a moment to get it written down. So from what you talked about, Dr. Malani, it seems like your specialty choice of internal medicine and then subspecializing in ID was helpful when you were applying, and then as you've been serving as the chief health officer. And it got me thinking, if you have any thoughts on how kind of like specialty decision making, because we're all, maybe some of us are going to be graduating this year, but are all making decisions about the specialties that we choose. And if we want to be involved in kind of the care that you are providing in the way you are now, if choosing a certain specialty might impact that trajectory. And I think of how all of our deans for the medical school, none of them are family medicine physicians. We have surgeons and IM. And I'm curious as to like what are maybe the different aspects of why we don't have that representation in that way, and then in other ways too at Michigan Medicine, just kind of as a whole.
Yeah, and Sammy, what year are you?
That is a great question, and it changes by the month. I will say I'm in between my M3 and M4 year. So if I come back in May, I'll graduate in May of 2023.
Okay, good. So you've had some clinical time. That's helpful. It's interesting here, and I think it varies from school to school. Family medicine, there have been people over the years who've had more of a role at the med school. I'm just trying to think, and they're really wonderful people. If you are interested in talking to someone about sort of that range of careers in family medicine, and the doctoring program, for example, and the program that preceded that called Family Centered Experience, there's a lot of family physicians there and a lot of primary care physicians. But you're right. You're some of the deans that you see. Dean Gay he does transplant pulmonology. He does ICU stuff, but he also really thinks about health equity and health policy. Dean McKean is ENT, does skull-based stuff. So there is definitely a big range. I would say, I think people decide they decide different things. Some people come in saying, I'm going to be a blank. I'm going to be a dermatologist. I'm going to be a cardiologist. I don't think I knew. I think I thought I wanted to do obstetrics and gynecology. And what I do is completely opposite of that. And I'm thankful, because it wouldn't have been actually a great choice for me personally. But I was really interested in health and health equity. I didn't know what it was called, but I think I was interested in teen pregnancy, especially back then. Again, it was, I had a limited view of the world, but that was something that I viewed as like a big problem that needed to be improved. And I think it has actually been improved, which is good. Infectious disease, ironically, most people don't do public health, although it is an element of infectious disease. A lot of us work at, big hospitals because we see complex patients, but, some people do primarily HIV and primary care. There's people who do that. I actually don't do any HIV in my practice unless I see somebody in the hospital. So there are ways to make it work. You can also do internal medicine and do public health. You could do medicine pediatrics and do public health. What I talk about is I call it like the lowest common denominator, like do the least amount of training that gets you where you needed to go. And not because you shouldn't do a lot of training, but, probably doing a, 7-year general surgery residency, like residency plus research, and then of subspecialty, in cardiac surgery, let's say pediatric cardiac surgery, for example. So it's 10 years. That is probably not the best way to go and do public health, right? Because we need really good pediatric cardiac surgeons, right? And, you know, I say that as someone who did 9 years of training, and my husband did 9 years as well, like, or maybe even 10. We lost track, but, you know, I think all the stuff you learn comes into play, and don't let things scare you off because it feels like a long road. I think you can find residency programs that sort of fit your interests, and you can also look at some of the things that people are doing that seem interesting, and the way they got there might not be how you get there, if that makes sense. And, you know, for public health, preventive medicine is a really nice way to do it. And that's not, I'm like, we never see anybody doing preventive medicine because it's based at the School of Public Health. Occupational medicine is one way, you know, and you can get skills a lot of different ways, especially today, you know, where you don't have to go and take a year off and go and study something. You can spend shorter periods of time. So, you know, I would say don't feel bad if you don't know what you want to do, because a lot of people end up switching their residencies also. Maybe less so now because people have a more prolonged way. And again, my husband is an example. He started in internal medicine, did internal medicine for 2 years, and he's ended up switching to ENT. He was really interested in radiology along the way. And, you know, all of it comes into play. Like what he does is really great care, because he loves patients. He loves seeing them. He loves thinking about them. He loves talking to them. And like, he's great at what he does. He's probably one of the best people who does his piece of ENT in sinus disease. And, you know, on the flip side, you know, I did geriatrics, which I don't do clinically, but I think of it as almost having learned another language. You know, if some of you maybe studied a different language, high school and college, like you might not use it every day, but it comes in handy. And it comes in handy in ways that you never think about. And I really feel, to me, that geriatrics training, which was just a year, was like learning a new language. It was that transformative. So you can get where you need to go lots of ways, but try to take the shortest way, because the worst thing in the world, I think, is to get through like 4 years of general surgery and be like, I don't want to be a surgeon. I think that's unfortunate, because it really feels like a ton of effort that maybe isn't helpful.
Thank you.
Yeah.
In terms of pathways to like being involved with journals and such, was that something that you had set out to do, or is that something that just sort of happened along the way?
So believe it or not, that's something that I really wanted to do. And there was no, Michigan Medical Journal, or, there was nothing like that back then. But what there was a journal called Pulse, which is the medical student section of JAMA. It's now defunct, but there was a medical student section back then. And I actually became an editor there, and I ended up becoming the editor-in-chief. My 4th year, I actually spent about a month at the JAMA headquarters, which was fun. And what's funny is the current interim editor-in-chief was a brand new editor then. And so I feel like I go way back with a few people. Now, it wasn't like I did that and then I became like an associate editor. It was like, that's just kind of one of those, funny stories about, maybe meeting your partner when you're in junior high, and then like, running into them, 40 years later or whatever, not 40 years, but like, 15 years later. It was kind of like it's like a side note that I happened to be there as a student, because my understanding of medical journals was pretty limited. But I do have that long history with the journal. I actually wrote an obituary in JAMA when they used to publish them, which, I always joke that was my first publication in JAMA. And it was on Leona Baumgartner, ironically, who, if any of you are from New York, she was the commissioner of health for New York City, and the health department is named for her. She helped advocate for fluoride in the water, among other things, around women and children especially. So I did that, and I was like, I want to be a journal, but how do you become a journal editor, right? And I did my medicine residency, and then I did infectious disease. And some of you know Dr. Kaufman, right? I think I know she just retired, but she was my mentor. Remains a really important person in my life. I think she created some opportunities for me to write and write papers, and like, frankly, it was like people who just never finished their paper right? Does that sound familiar? Like they did the work, they wrote the abstract, and then the paper just kind of sat there on the back burner. I took a lot of those projects and actually moved them forward. And, again, I was really interested in becoming an editor, but there wasn't like a direct path to doing that. And what I did was, again, I think I knocked on doors and asked people if I could be helpful. And, sometimes they said yes, sometimes they said no. I got involved with my specialty society, SHEA, Society for Healthcare Epidemiology in America, and I volunteered to be on the publications committee. And I was a fellow at the time, and they did put me, I was like a fellow, but like junior faculty. And so this was maybe 2002. So 2002, 2003, long time ago. And, I went to the meeting, and I actually brought my resume, and I went up to the editor afterward, and I introduced myself, and I handed him my resume, and I said, if I can ever be helpful to you, let me know, because I would love to help you. And then literally a year later, he emailed me, because I think it was like just like under a big pile of papers. And I remember it because my daughter, who will be 18 tomorrow, was a week old. She was like this newborn, and I'm dealing with, just trying to deal with the older one and dealing with her. And the editor said, are you still interested? I'm like, yes, of course I'm interested. Tell me what to do. And, anyway, one thing led to another, and I ended up becoming like an assistant editor of that journal. And then I, did everything I could to be helpful. And then like I kept talking to other people, and I would ask questions. And then I got onto another publications committee. And then I ended up becoming a deputy editor at this other journal. And in between, so this is really important. And Morgan, in the intro, you said this, I did a master's in clinical research design and statistical analysis. And you can't just be a good writer and like to, like words and, like to read. And you have to actually have some of the skills. And I would encourage you at some point, maybe med school, maybe residency, if you are interested in this, is you have to get those skills. So epidemiology, biostatistics, clinical research design. And the program I did at our School of Public Health was was an on-job on campus. So I did that actually when I was older. I was an assistant professor. And I will tell you, it was the hardest piece of my education. It was really rigorous. I had 2 young kids. I was busy clinically. I underestimated how much work it was, but it's probably one of the most important things I ever did. And so I think, again, those opportunities come up. Someone was willing to support me to do that. And, now like everything's on Coursera and stuff, right? But it's hard to learn when there's not like a deadline and there's not a assignment and there's like a test. And, I don't think I could have done it otherwise. And so that was a really critical piece in terms of then continuing on. And, the JAMA thing, one of the things I did was I kept writing book reviews for them. And again, they don't have a book review section, but I probably wrote 20 book reviews over the course of several years. So they knew my name, they knew I knew how to write. And then my name kept coming up because they needed an infectious disease editor. And actually he was an anatomy professor here. He was a part-time editor at JAMA, and I got to know him a bit because he was the book review editor. He advocated on my behalf. And he told the editors, he's like, you have to look at her, like, take a look at her, bring her out. I think you'll like her. And, one thing led to another. I went out there for an interview because then they needed someone to do geriatrics as well. And so it was right time, right place. And once and that was 10 years ago, it'll be almost 10 years that I've been there. And I've learned so much there. It's just a whole different level. And I'm so grateful for the opportunity to be there and to really help elevate some of these issues that I see clinically. And I'm a little different than a lot of the editors. A lot of the editors are very famous researchers. They are, they have all these big grants and they publish clinical trials, and I'm a little different, but I think that difference is not a negative thing, if that makes sense. So, again, it looks like it's a straight line, but it was a lot of like knocking on doors. And I won't even tell you all the people I asked who said no, because it doesn't matter. You just got to keep asking. And, I'll say is that if you're doing research with your mentors, you can you can ask about this kind of stuff too. And a lot of them who are editors, ask them how they got involved. And I think that there are so many journals out there that if you have some skills and interests and you're a good writer, it could be like you could become the social media editor for something. That's something that those editors are younger. They're more junior by definition, because the older editors aren't familiar with how to use social media, for example. So don't assume that this is like off limits to you in any way.
That was an amazing story. Thank you.
It's a long story. Oh, yeah, nice. Current neurosurgery resident. Yeah, so good example. I didn't know that. And again, I think publications committees are good. There's some journals that are based here. The editors in chief are here. So hopefully you are networking with them. And, if people are editors, ask them like, can I help review? I will also say that being a good reader and good writer, they go hand in hand. So reading the journals. You're going to ask anything, AMA, right? Ask me anything.
I'm curious, you mentioned that you had learned a lot, like in your position as an editor at JAMA. I think maybe this is like my fault, but I think of that sort of position as like an endpoint, and like didn't really like do a lot of thought about like what the learning process is once you're in that position. Do you mind talking a little bit about that, and also how the role might have been affected by the pandemic? Because there's a lot of changes around that.
Yeah, thanks for the question. So I started 10 years ago. It'll be 10 years in the fall. 2012. So I was, a little different point in my career at that time too. And I was really excited to be there and to work on papers and the rigor was just a lot harder. And I got good at looking at protocols and clinical trials registration, things that we didn't do at the other journal I had been at previously, which was a very, very good specialty journal in infectious disease. But the other thing is, once I got there, I started like, sort of doing other stuff. So there's a news section at JAMA. So they had a blog, and I remember writing a blog piece around, at the time it was Angelina Jolie had written a piece in the New York Times about the mastectomy that she got because of her BRCA positivity. Again, it was a long time ago. Probably you were, many of you were youngsters and maybe didn't pay attention to it. But, I ended up writing like a little blog post on that, for example. And, I would write these little news stories and then within a year of being there, the editor-in-chief elevated me to this other role, like directing media relations. He said, I just think it would be kind of interesting to have a physician run that, because that's a communications role. It's a journalist role. But he said, what if you did that? And so I did that for 3 years, and I learned about multimedia. I learned about podcasting. I learned about social media. I learned about crisis communication, which really came in handy the past couple of years. And like just working rapidly, working with the press. I actually, in 2020, they did a search with these search engines for media. And I was quoted in 2,400 articles. And I was on everything from, I was on Cuomo's, on CNN to like, NPR to like everything in between. And it was just, that work ended up really making me able to handle that, like in a sense, like just being able to deal with all those reporters and like, so, again, learning curve. What else have I learned? I feel like I'm, even now with papers, I'm learning new statistics. I'm learning new methods, issues. The other thing, and this is probably interesting to you, A Piece of My Mind. Do you ever read that? Okay, so I edit that. I'm the editor of A Piece of My Mind, and I've been the editor there since 2017. And before that, there was someone who was editor there for like 20 years, 30 years, non-physician, really great editor, someone that I learned from as a medical student and beyond. But Howard Bachner, who was the former editor-in-chief, said, if you want it, you can do it. And I said, I would love it. And so I started doing that. And, that section's really taken off. And it's always been a great section, but it's taken off in a different way. It's taken off in a different way during the pandemic. And I think having the eyes and ears of a frontline clinician, and I will add, I think being a caregiver, having children of my own, and thinking about how difficult it is. Like I'm looking outside and there's snow. It's a snow day today. For families, there've been 700 snow days in a row right now. And I don't know if any of you are affected, directly with the caregiving issues. I know, Sammy, you're talking about your grandma, but this has been an extraordinarily difficult time for people personally. And I think capturing that and seeing that and elevating that in those pieces has been a big opportunity too. And elevating voices that are diverse voices, people that you don't always hear from in private practice, non-physicians, international authors. So issues around gender equity, issues around LGBTQA plus issues, issues around race, microaggressions, like things that are pretty sensitive, but to raise them in a voice that's productive. And and there've been some really like provocative pieces, but I'm very proud of that editing. And it's a process because you see something and sometimes it's a diamond in the rough. Mental health issues. There was a wonderful, wonderful essay written by a Michigan medical student a few years ago. It's called I Solemnly Share. And I didn't edit it because there's a conflict of interest. There've been a number of Michigan medical students actually who've written pieces. But I did help her with the initial draft. And she wrote about coming out of Taubman Library and walking out in front of a bus to kill herself. And then she stopped because she thought about her parents. And, I get emotional just talking about it. And to take something like that and help her share that story. She was an amazing writer. She actually had a master's in narrative medicine, but like to help her elevate that story was like such a high point. And, she ended up going into psychiatry and she continues to do work on well-being. So I think something like that, like this idea that it's also a mentoring role, believe it or not, because, you're going back and forth with people and it's intense. Like they're sharing something so deeply, deeply personal. And many times, it's the loss of a loved one. It's the illness. There was one from a few weeks ago, really beautifully written, a gentleman who is critical care and palliative care trained. And he wrote about his own illness and that it's going to take his life in the next couple of years. And he wrote about that. And that's like, wow, like it's just, this idea of you read something, it's 1,000 words and it stays with you. So anyway, if you don't read those, I would encourage you to read them. They come out every Tuesday when the journal is published every Tuesday. It's online and all the time. And there's 48 times a year. So the months with 5 Tuesdays, they don't, you get a week off. Oh, good.
We got the correct link.
Yeah, great. Thank you. Thanks for, yeah. And you can, you should be able to get that through the med school. And hopefully, some of you probably have access as students too, but, just practice reading that. I think it's really a beautiful exercise in sort of just day-to-day observations. There've been a couple like from retired physicians who gave vaccines. There's one, it's called The Taste of Hope. And it was just a kind of a neat piece because she talked about going to get polio vaccine as a kid and how she never forgot the taste of that sugar cube. And that as an adult, a restaurant was asking for tastes of nostalgia, of tastes of childhood. And she said, the taste of the sugar cube is what I remember. And, it's just kind of like interesting. I'm like, wow, that's like a really, that's like something that probably everyone from that generation can remember. A taste of hope.
This is this is just an unfair question to ask, but I always think it's interesting to just hear people's perspective. Because what you were saying earlier too about trying to find the lowest common denominator for your ultimate like course of action trajectory, would there be something you would have maybe done differently or done faster or shorten one aspect of something maybe you were involved in to try to have that
Yeah.
low denominator? And if so, what would that be?
You know, it's interesting. If I were going to do it again, so I think a few things. One is I would have probably tried to go and work after finishing my master's in journalism. But like, that wasn't like, you just didn't do that. You just were like, got to keep going. And what I didn't share with you is that I actually graduated in 3 years from Michigan. And I think that was just like really absurd when I look back at it. And it wasn't because I came in with a million credits. It was that I just really like felt like I needed to keep running. And I wish that I maybe had been able to step back. And I think some of that is just my own background and, you know, my family situation where like, you know, there wasn't this like, oh, go hang out and go travel the world. Like that wasn't really an option for me growing up. And it just wasn't something people did. I'm really grateful that I'm an internist and that I've done infectious disease. I think I picked the right specialty. I would have appreciated the opportunity to have gotten some of that research know-how earlier in my career because it was difficult to get later, but it wasn't an option back then. So I think that would be something that might have been better. That said, maybe I would have pursued a traditional research career and then I wouldn't have done all these other things. So you never know. Like I said, I think everything kind of works out. Let's see what else. Yeah, I think I would probably do it pretty similarly. I would have maybe, you know, worked a little harder at certain things and less hard at others. But that was just, you know, learning process. I think, you know, when I got to Michigan, you know, and Sammy knows, you know, I was graduate Grosse Hill High. You know, I was one of the better students there, but I came here and it was challenging for me. And I don't think I really understood how to study. But, you know, I'm talking about like something from 35 years ago. You know, I was talking to my daughter about this, who's a senior right now and will be, you know, graduating in a couple months. And I said, you know, I think that I would be a different student today. Because I think she asked me, well, do you think you would get into Michigan today? And I said, yeah, I do. But that's easy to say. You know, I said back then it wasn't that hard, frankly, to get in. But I would be a different kind of student today than I was because the world was different. So anyway, so I think we learn in every step. But I think if you can stop and like reflect a bit and be deliberate about those steps, if you're able to do that, it's great.
Thank you. No, I agree. I'm since taking time away from medical school, I think that's been so helpful. And then hearing it from classmates who have just kind of gone straight through and are going into residency in the summer and then saying that they wish they had a little bit more time to think about things. So definitely appreciate the reflective piece. On that note, much earlier in the conversation, you said something to the effect of you were feeling like you were not growing in something that you were doing for 10 years. And that's kind of what led you to actually take that job posting for chief health officer seriously. Can you articulate what you were feeling or thinking? Because I think we all experience that at some point. It's very hard to put into words. So if I could ask you to do that.
Yeah, absolutely. Let me try. And like, I want to clarify, it wasn't the editing job. So I've been an editor since 2012. In 2014, I took a second role at JAMA as the director of media relations. And I did that role from 2014, 2015 through the end of 2016. And I think at that point, I just like towards the end of 2016, I was able to say, you know what, it's just time. It's time for me to move on. And there were lots of considerations, but I could have kept doing it, but I just didn't feel like it was that hard. And I felt like at that point, you know, I mean, at some point in my life, I'm going to be happy when things aren't so hard, but I feel like I'm still growing and I'm happy to share. I'm 52, so I can share that with you. I feel like I still have a third of my career ahead of me, you know, it's funny because we spend so much time getting ready, you know, for like that first job, right? Like we're not young when in medicine, after you finish your training, you know, you're already like pretty far along in your life. And I mean, like I had 2 kids, I had a house, you know, I wasn't like 22, like my son will be. My son, in fact, is 21 and graduating from Michigan and has a job in Chicago, like a really good job. And I'm like, gosh, you're kind of young to be going out on your own. You sure? You know, like it's kind of funny. It's sort of the opposite situation where I'm like, oh, you sure you don't want to do a 5th year in Michigan? You know, but anyway, I felt like I wasn't learning. You know, like when you first start something, there's so much to learn and there's so much interest. Like it just got to be where it was easy and there wasn't anything new, and it would have just sort of stayed the same. And for me, that wasn't like something I wanted to do. And I'm trying to think about it. It was 5 years ago. So I was sort of thinking about, what do I need to do for my next, and I didn't know it. So in this case, I had no idea what my next step was going to be. And that's kind of scary. And that's the only time in my life that I did that, where I said, you know what, I'm not going to work full time. I'm going to like step back. I'm going to keep doing my stuff. I mean, I worked full time even after my kids were born. And it definitely got ugly at times. That's a whole other story. But this was like the first time where I just said, you know what, for a few months, I just want to go like 60% or whatever it was. I want to figure out what I want to do. And what I thought I wanted to do was right. And I felt like, I understand how to communicate and I understand how to write, and maybe I can like be in this space. And then this job magically appeared. So sometimes, that idea of the prepared, I don't know, there's some expression, right? Fate favors the prepared. I don't know. What do you guys know what I'm talking about? There's some expression. What is it?
I think it's luck favors the prepared, right?
Yeah, something like that. But you know what I'm saying? Like sometimes when your eyes are open and you're looking, and again, I think the world is different, these days in terms of just even how opportunities come your way. So that's what I meant. I wasn't really learning new stuff, or the pace of growth was different. It's kind of boring, I guess, is what I would say. It was becoming boring, and I didn't want that. I wanted to keep learning something new, and I have.
All right. Well, we're coming up on 6 o'clock. So if anyone, there aren't any more questions, I want to say thank you so much, Dr. Malani, for spending your evening with us. It was wonderful to chat with you. Also, as just a general MJM plug, this is my last event as education editor. I'm going to be transitioning to editor-in-chief role. So if you guys have applications that you're looking to submit for lead editor roles, that application will be open through February 15th. So that's all I've got for this evening. And again, thank you so much, Dr. Malani. It's
you're welcome. And best wishes to all of you. It's really an exciting time. I think it's a really exciting time to enter medicine. This is like, I think this is a time where we're going to just see a ton of transformation. So we need good thinking and creativity.
100%.
Thank you so much.
Hey, be safe, everyone.